I knew one or two people who had had prostate cancer. In fact, I knew a gentleman who had recently died of prostate cancer. But I really didn't know what it was. And to be honest, I wasn't sure what the prostate was or where it was, which is probably in common with 9 out of 10 guys. I suppose whatever cancer, there's a high risk and a seriousness there. I was certain that some cancers, diagnosed early, there would be a reasonable prognosis. Didn't know anything about it, nor the treatments. I hadn't really thought about it at the time. I suppose one's always guilty of not thinking about things that don't affect them. I don't think that there's a hard and fast reason, even by the experts, put on it. Like so many other conditions, lifestyle perhaps comes into it, maybe environment, certainly genetic factors are involved. And I know among friends who have prostate cancer, whose father had prostate cancer, whose uncle had prostate cancer, and whose brother's got prostate cancer, which highlights the genetic involvement there. So yeah, there's genetic, perhaps cultural and environmental. I know for a fact that Afro-Caribbean gentlemen, for example, are 3 times more likely to get prostate cancer than a white British person. It's suggested that a lot of red meat, a lot of dairy products are not necessarily advisable. I went to the GP. On the first day I had passed blood from a back passage. It struck me, passing blood is not a natural or healthy situation. And as I went to the doctor the day it happened, going to the blue a little more often than usual might just be an infection. It wouldn't be natural to get up in the middle of the night 6 times, for example, or to have a pain when passing urine, or stopping and starting, or not being able to stop or start. There's something wrong if that happens, and go and get it checked out. Probably in those instances, cancer would be the last thing in my mind. I'd probably think of it in terms of an infection or a virus, but it needs to be checked out. I was referred to a specialist on the basis that it may well be an indicator of bowel cancer. And having been examined by a bowel specialist, he informed me that he had detected that the prostate gland was enlarged. I had a biopsy for bowel, and that was clear, but it was followed up on the prostate. I certainly wasn't concerned about it. From the moment I was given the cancer diagnosis, both Barbara and myself were quite positive. In fact, having been given the diagnosis, coming out of the clinic, I remember saying to Barbara, well, today's the first day of the rest of my life. What are we going to do about it? Business as usual. Certainly not waste time. Go straight to the GP. There's no reason to be embarrassed. You're dealing with professional doctors and nurses. You haven't got anything they haven't seen before. When it comes to health, when it comes to illness, the sooner a problem is diagnosed, the chances are the better the treatment, the more successful the treatment. So by delaying, by putting your head in the sand, by trying to dismiss the facts in your own mind, you're wasting time and you're probably causing yourself a lot more of a problem.